In this video, we will cover everything you need to know before your baby's first pediatrician visit. What to bring, what to expect, and how to get the most out of your baby's first doctor visit. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want child-centered approach to solve their children's health issues. So, if that sounds like you, make sure to subscribe to the channel for more content just like this. Your baby's first pediatrician visit is the first step in establishing care with your child's doctor, and it is a great opportunity for new parents to learn more about their baby's health and growth. Your baby's first visit is usually after you leave the hospital, within 2 to 5 days from getting discharged from the hospital. So if you have a home birth, your baby will generally be checked and examined at the time of birth, and then followed closely in the first 4 to 6 weeks of life to ensure that he's healthy, gaining weight, and thriving. Now, I've been a pediatrician long enough to know that life for new parents in the first weeks feel hectic, and the days and nights can get blurry and blend together. There's a lot on your plate. So let alone get yourself ready and get the baby ready to go to his first doctor's appointment. So this, for many people, can be a very stressful time. So don't worry, in this video, we will go through everything you need to know before going to this first appointment. Before a checkup, what to expect. First, you probably want to bring your baby. Just kidding. But do bring your baby, carrying him in a car seat or stroller, whichever you feel more comfortable transporting your baby from your car to your doctor's office. Secondly, if you have any discharge paperwork from the hospital, these are usually these paperwork that's tucked away in the newborn folder that's handed to you amongst other things before you go home from the hospital. What your doctor is normally looking for in these paperwork is discharge summary about the baby's stay and care given at the hospital, such as the baby get any immunizations, whether any medications given, was there any kind of interventions or screening or test that's done. Generally, most hospitals will do your hearing screen, your first newborn screening, which is given to all babies to screen for congenital metabolic disease. And generally, the hospital will leave you with a second copy, carbon copy, of his newborn screening to be done with the pediatrician. Thirdly, you want to bring a change of clothes, a blanket to keep your baby warm during the exam, and extra diapers and wipes just in case you need to change his diapers or change his clothes. And fourth, if you are bottle feeding, bring a backup bottle of milk just in case the baby gets hungry and needs to feed. For the most part, you can and should feed your baby if he is hungry, even during doctor appointments. And most pediatricians will be well equipped to work around that. Lastly, if you're like me, who can't ever recall my questions on the spot, bring a list of questions that you want to address with your doctor as they come up during the first couple days before you see your baby's doctor. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you can be notified of future content just like this. Now let's move on to during the checkup, what to expect. Now, this is generally done in all pediatricians' office after you check in your newborn. You'll get measurements for the baby. We generally measure your baby's head circumference, length, and weight. And this is because this gives us a good idea how the baby is growing. And because the newborn babies, a few grams and ounces can count a lot towards your baby's weight gain and growth, most pediatricians will want to measure your baby without clothes or stripped down to clean, dry diaper. After that is done, we will get to talk to you. Generally, we'll get a full history, including your pregnancy, the birth history, and what happened immediately during the postpartum period, either at the hospital or at home. We'll also ask questions to get an idea of who's taking care of the baby at home, who's with the baby, and any relevant family medical history, especially in the mom and dad, and also your close relatives. Any health issues that might prompt close attention to as your baby grows older. Then, of course, we will examine your baby. We will do a full body exam on your baby from head to toe, looking for symmetry, growth, tone, and any abnormalities and skin lesions. So I will try to break this down for you on the physical exam so you can have an idea what we're looking for. We are going to check the neck and collarbone for any birth-related breaks or fractures. We'll check for the soft spot on your baby's head called the fontanelle. We'll look for signs of hip dysplasia, meaning any clicks or clunks or abnormalities when we're moving their legs and hips. We'll assess your baby's reflexes, check your baby's pulse, and ensure normal development of the genitalia, and also see how the umbilical stump is healing. In addition, we're also going to check the baby's heart, look at the skin for any jaundice or any skin lesions, and lastly, review these results for you so you know what to look for. And please keep in mind that every pediatrician has been doing this for some time, and they may have their own rhythm or way of checking out the baby. So everyone's going to do these in somewhat of a different order in their own idiosyncratic ways. So just be patient and just ask questions if there's anything that comes up. Now, during your baby's first pediatrician visit is also a great opportunity for families to ask questions and talk about what to expect when you are caring for a newborn. Some of the common discussion topics include feeding, like how is your baby feeding? Is he breastfeeding, formula, or both? How to know if they're feeding enough, because that's frequently asked, and safe storage of breast milk and formula, because that does come up every day. We'll talk about sleep, like how many hours your baby is sleeping, the nap schedules, safe sleep practices, and how to avoid sudden infant death syndrome, which is short name for SIDS. We'll talk about elimination, like how many wet and soiled diapers to expect that's normal for the baby's age, what color should your baby's poop be, and how to prevent chafing or overwiping. We'll talk about developmental milestones, like when to expect your babies to start responding to sounds, when they may raise their head, when they may start smiling either involuntarily or voluntarily in response to you, like social smiles, and when they are going to learn to start following objects with their eyes. We may also discuss when to start tummy time and what are appropriate toys to give to your baby depending on their age and their development. Your pediatrician will also talk about safety, like car seat safety, home safety, and how to take your baby's temperature. We may talk about vaccinations, such as the recommended vaccination schedule or when that first set of vaccines should start. And we'll also come to assess the parents' understanding any questions they have regarding the vaccines your child might be getting. And lastly, and this is definitely not to be overlooked, the pediatrician will talk about parental well-being. That means we may ask you as a mom how you are feeling and if you have any concerns for postpartum issues like anxiety or sadness. And here are some important considerations. Remember, don't hesitate to call your pediatrician's office with any questions or concerns or even after hours. Be honest with your pediatrician, and if you are worried that you're doing something wrong, they are there to really help you. Lastly, I just want to throw in that your baby's first checkup can range anywhere from 15 minutes long to 30 minutes long, but be prepared that the waiting time can be anywhere from 10 minutes to maybe even an hour. But for some concierge-like practices like mine, we block out 60 minutes for every newborn to allow time to discuss all the areas of concern without rushing. So knowing the time expectation, I hope that this will help you prepare how much milk to bring or what you need as provision. And before wrapping up your visit, your pediatrician will make a recommendation on how soon your baby should be back. This can vary depending on the baby's needs, such as if there is something concerning that needs close follow-ups, but it is recommended by the American Academy of Pediatrics generally to have a newborn well check, a 2-week well check, and then a checkup at 1 month old. So you see, we will be seeing each other quite frequently in the first months. And there you have it, everything you need to know before your baby's first doctor appointments. Remember, your pediatrician is here to help you, and it is an opportunity for all of us to work together towards raising healthy young children. So if you have questions about that first visit that's not covered here, please leave it in the comment section below, and I will do my best to address them. In our Las Vegas-based practice, me and my team work with families one-on-one, offering concierge, individualized care to each patient holistically. minimizing unnecessary pharmaceuticals, and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching, and tune in next time for more holistic pediatric medicine.